Today's presenter is Michelle Hedding. Michelle is the Spiritual Care Coordinator at Washington Hospital. She received her master's degree in spirituality and culture from the Sophia Center at Holy Names University. She is a registered nurse with her master's in nursing. Michelle is also a certified hospice and palliative care nurse. She worked at Washington Hospital as a staff nurse prior to her current role as the Spiritual Care Coordinator.
So thank you guys for being here tonight. Washington Hospital has been committed to advanced directives being more discussed in the community for over a year now. We've been putting a concerted effort. So some of you may have heard talks on this topic before. I tried to change it up a little bit tonight. But it's an important conversation really to have with your family, with the ones you're caring for, and definitely with your doctors, so that we know what your wishes are regarding healthcare decisions. So as I titled the talk, it's your choice, it's not our choice. We want to make sure we're honoring your wishes. So, and the other thing, a lot of people hear advanced directives and they may immediately think DNR or I'm gonna die, and if they even talk about it, it could be bad. But the reality is it's really about how you want to live. So this little mnemonic, to learn about end-of-life services and care, it's to educate yourself on what's available. Last week, if you were here, Father Jeff, who's our new palliative care coordinator, talked about hospice and palliative care. Inform yourself about what your options are. Implement plans to honor your wishes. So that's the documents we'll be talking about tonight. That's a way that you can put it into action, what you want to be done. Voice those decisions to family, friends, healthcare providers. If you just talk about it amongst yourselves and never tell anybody, it's not going to go anywhere, right? So talk about it, voice your opinions, and engage in personal and community efforts to improve end-of-life care. And even just by being in a workshop like this, you guys are participating in the community to just continue to raise the awareness. So what we're going to talk about tonight is why is it important. I'll go through advanced healthcare directives, the ins and outs, kind of some of the things that you need to know about that. We'll talk about the POLST form, and I brought some, and you'll see what it looks like, but they're a pink copy. So at the end, I'll have these available in the back. And then we'll have time for questions and answers. So why is it so important to have these conversations? I'll give another plug too. We recently had a very popular screening of the documentary Being Mortal. We'll be doing it again, and there's flyers back on the back table at the end of September. It was a book written by Dr. Atul Gawande. He's a surgeon in Boston, and it just talks about 5 different stories of why having these conversations is important. So that's just kind of a teaser. I welcome you guys to come back. It's a Wednesday night, and like I said, flyers in the back. So some other statistics on why it's important. The California Healthcare Foundation did a survey a few years back. 60% of people say that making sure their family is not burdened by these tough decisions is extremely important to them. 56 haven't made it clear and communicated their end of life. So there's kind of a mixed balance there, right? 60% think it's really important and 56% haven't talked about it. So that's one reason why it's important. 80% of people say that if they were seriously ill, they would want to talk to their doctor about end-of-life care. 80%. 7% have actually reported having had that conversation. Is it an easy conversation to have? Not at all. I see heads shaking. It's not an easy conversation. Facing our own mortality is a difficult conversation to have. But as one of the sound bites from that documentary, Dr. Gawande says there's 2 things that are unfixable: aging and dying. Those are 2 things that we can't fix, right? So important to have the conversation. 70% of people say they would prefer to die at home, and 70% actually die in a facility of some sort, whether a hospital, a nursing home, or some other facility. So again, there's just this mismatch. 70% would actually rather die at home, but if they never speak up and tell their family, you know what, it really would be important to me. If I'm near the end, please do what you can to get me home. 70% haven't been able to communicate that. So regardless of which path we take, and these little charts talk about different ways that we can find our way to the end. The top one is talking about something where you get a diagnosis that's a life-limiting illness, something like cancer as an example, and you kind of have a decline and you die. or you have chronic illness, lung disease, heart disease, and you have these exacerbations where it gets really bad and then you kind of get better, and then, or just the typical aging and dying and just kind of getting more frail. It doesn't matter what path we take to the end, it's really important to have a plan. That was the other thing that Atul Gawande said, hope is not a plan, right? We can hope that it's gonna work out okay, but unless we plan, we may not have it work out the way that we would want it to. So 4 things everyone should know about end-of-life planning, and this was something that I found from a doctor who is a critical care doctor and a pulmonologist. So he faces people that are dealing with some really serious illness, right? He said, know that it's okay to talk about it right now. Again, there's that worry that if we talk about it, something bad's gonna happen. Well, something bad could happen anyways, but if we don't talk about it, you know, we don't know. Know who your proxy is or your agent, the person that you want to be your voice. If, like Linda was saying, you at some point don't have capacity to make your own decision. Know who will make the decisions in your stead. Not their decision, but your decision, right? Know that you can change your mind. There's 5 Ds that they talk about. Death. So if someone in your family dies, you may have a different opinion about how you want your end to look. Divorce, obviously maybe you need to change an agent or something like that. Diagnosis, you're going along, everything's good, and all of a sudden you get a really difficult diagnosis. You may want to make some changes. A decline in your health, so as we're aging, things will change. Or just every decade, you know, you can always reanalyze your document and make a change based on what makes sense for you at that time. And then 4, of course, know that you can always ask questions, which again, you'll have time at the end now to ask questions, but about your health care, ask your doctor, what happens if I go down this path? What happens if I go down that path? So you can make an informed decision. Brief history of advanced directives. Living wills and advanced directives have actually been around for 50 or more years. It's, again, as Linda was talking about, back in the day, it was kind of called more of a living will. Now, advanced directives are the way that you can document your healthcare wishes. In 1976, California state law enacted that advanced directives existed, and in 91, it actually became a federal law. So if any of you or your people that you're caregiving for have been admitted to the hospital, that question is standard. We have to ask, do you have an advanced directive? If you don't, we hand you a brochure and let you know what it's about, but it's federal law. That's how important it is. And then in 2001 is when the California law was implemented that put the POLST form into effect. So that's kind of the history. There's lots of different forms. This is sort of the screenshot of the standard one that we hand out in our packet, which are also back on the back table. It looks like this, and inside at the very end you'll find the actual legal document. There is another basic form that's out there. That's what the POLST looks like. And then the 5 wishes. I know a lot of people know of what that is. Father Jeff mentioned it last week as well. It's available for purchase. It's not something you can make copies of because it's actually copyrighted, but it's just a different version of an advanced directive that goes into a lot more detail of your very specific wishes. So it's really helpful for people that are maybe having a hard time kind of coming up with ideas of things that would matter to them. The other 2 forms and many of the other forms that might be out there are a little bit more legal-like. The 5 wishes is more interactive, social, spiritual. So advanced directives, there are many forms, as I said. You don't need a lawyer to execute one of these documents. And you can either have it notarized or you can have 2 witnesses sign to witness that you are who you say you are. The witnesses one of them can't be related to you, they can't be on your medical team, and they can't be the person that you're naming as your agent. So it could be people sitting next to you in this workshop, it could be your neighbors, it could be people you go to church with. It doesn't really matter who it is, all they're doing is looking at your signature and saying, yep, that's who you say you are. That doesn't make them in any way responsible for your health care or anything. And then the POLST is a little bit different, so we'll talk about some of those differences. So again, that's the image of the POLST. What the POLST form, this is a clearer copy, what this does, we actually recommend the POLST form. Let me back up. The advanced directive should actually be something that everyone over 18 has, is what we recommend. If you're under 18, your folks are going to be the ones to make decisions. If you're 18 or older, you really should name someone to be your decision maker. So what we recommend for the POLST is that it be someone who's either chronically ill, living with some sort of life-limiting diagnosis, or the general litmus test is if you wouldn't be surprised if they died in the next year. So it could just be someone who's older, frail, again, someone who, the question of the mortality is a little bit more up in your consciousness. And this actually gives very clear directions to doctors, to ambulance drivers, to skilled nursing facilities on what your wishes would be specifically if your heart stopped or if you stopped breathing. So that top section, this top section is where you would say either yes, you would like to attempt resuscitation, or no, just allow a natural death. So that's really, it's kind of black and white, right? Your heart stops, you stop breathing, which way would you like us to go? And you can choose either. But this is what this form is intended for. In this next section, it talks more about the level of treatment that you would want. So if you want to have resuscitation and have full treatment, then you go ahead and check that top box. Maybe you want a lot of the treatment, but you don't want everything, so then you would select selective treatment. And maybe, you have been living with cancer for a long time and you are nearing the end and you're more in a hospice phase, then you might check comfort measures only, which would focus very much only on your comfort and symptom management. The C section is for what your wishes would be around artificial nutrition. So that could mean a tube in your nose or a tube in your belly. You can either select, yes, I would like that long term, or you can say just a trial period, or you can say, I don't want that under any circumstances. And there's room for you to add additional notes on here. So if you have specific, if you say, I'd like to try it for 2 weeks, or I'd like to try it for a month, you get to make that specification. The bottom section talks about if you have an advance directive, it allows you to put that healthcare agent's name. And we do recommend you have both. The POLST form is an executable order once a doctor signs it, but it doesn't name the agent. You can list the agent if you already have them designated, but it's not a document where you can actually select an agent. So really they work in partnership with each other. And then at the bottom, as it says, it's a signature of a physician. Once that doctor signs that, you can go anywhere with it, and it's an order that has to be followed. This symbol up in the corner is the Emergency Medical Association. They were actually instrumental in getting the law passed back in 2001 because they don't want to transport someone and end up doing something to them that they don't want done. And without an order, they have to do everything, and that may not be the person's wish. So that's in a nutshell what the POLST is. This kind of brings it all together. Advanced directives are general instructions for future care. So you can specify in an advanced directive your general wishes for end-of-life treatment, but it's not as cut and dry as the specific orders that are in a POLST. So that's kind of the difference there. Advanced directives require some interpretation. So you may say, I choose not to prolong my life if I'm in an incurable situation. There's some gray area there, and you would hope that you'd had a conversation with your agent so that they would be able to assess what that means to you, but it's not as cut and dry as the POLST form is. So the advanced directive needs to be retrieved. We do recommend that you go ahead and have it scanned in here at the hospital, but if we don't have it scanned in, then you'd have to go and find it and bring it in. The POLST form, we actually recommend that you bring that with you because, again, if you're in the ambulance, you want that to be, the instructions to be clear. You can put it on your refrigerator. Ambulance drivers will look for it. So that stays with you. If you come here, we make a copy and give you back the original so that when you leave, you bring it with you wherever you go next. Advanced directives, there's lots of different forms. It gets signed by the patient and by witnesses. The POLST is one single standardized form throughout the state of California. Different states have different laws, so that will vary from state to state. But it's signed by the patient or the agent if the patient no longer has capacity, and the doctor. And then that last part is that an advance directive can only be executed if the person who's writing it has the capacity to make decisions, right? So if you're caregiving for someone who no longer has the cognitive ability to make decisions, then you would need to do a POLST, okay? Advance directive only works if the person has capacity to make decisions. So that's kind of the summation of that. Advanced care planning, again, as I said, we recommend that you get one at the age of 18. Keep having a conversation throughout the whole thing. Update it periodically. We talked about the 5 Ds, right? And then as you get along in the process, we would recommend a POLST form. And the outcome is always going to be that we're going to give you treatment that matches what you want to have happen, that's going to match your values. So I like to leave a lot of room for questions because often there are a lot of questions. So that's where we're at now, is questions.
For the advanced care directive, let's say for a young couple, they don't have it, those forms ready, and let's say something happened to a spouse, a wife, would it be automatically the husband is the main decision maker?
The way California law is stated, there is no law that says in order of succession. So generally, our standard would be the person who knows that patient the best. So most cases, that's going to be the spouse. But if you don't have someone named as the agent, it can get complicated. Because if there's parents involved, if there's siblings involved, all those people can show up and try to have a voice, and it gets really complicated. And if a conversation has never taken place, it can get really, really complicated.
Thank you.
Yeah.
This is an odd question. Has anybody ever done this on DVD, on video?
Huh.
Instead of writing everything out? Can't they just, I'm going to go on YouTube. I already decided that's what I'm going to do.
Yeah, yeah. I mean,
has anybody done it like that?
From a legal standpoint, I don't know if that would hold water as far as naming an agent, but I do know that people have said that to me, so that there isn't argument among the family that's going to gather at your bedside. If you put it in your own voice and your own face, it makes it really clear what your wishes are. But I think I would still recommend, and I'm not a lawyer, but I would still recommend getting the document filled out. But I think that would be very helpful, because as everyone gathers, you can just, direct them to play that video, and then...
Or the technology now, if you go to the moon and get your ashes sent up there, why not that?
Exactly.
Why not?
Yeah, I think I would think of it in tandem with the legal document, just to make sure you're covered.
Okay.
Yeah.
And you know what? I have never heard of an 18-year-old being confronted with something like this. They think, when you're 18, you think you're going to live forever.
Yeah, absolutely. And we all know that any of us, life is a fragile and precious thing. We never know. And you're right.
They should, like part of the DMV, they want to know if you want to be an organ
Organ donor.
Right. So why don't they mention about the POLST then?
Good
they should.
question. Yeah.
Never have I been brought up to this type of information.
Yeah.
You always think about when people are old.
Right. And there's another saying that I've heard lately. It's always going to seem too early until it's too late, right? So, some people have a conversation around like a holiday meal and just talk about it. That's the thing that we're really trying to do, is to make this a common conversation. It's not an easy conversation, but we are all human, and we do know that at some point we'll have a final chapter in our lives. The other thing that's in the packet back there, there's a group called the Conversation Project, and they're a national group that is working to, again, just raise the bar on awareness around these topics. So there's a starter kit, a conversation starter kit that's in this packet, And it allows you to sort of write down your different thoughts and wishes about your values, and it helps to break the ice a little bit. So you might take a look at that and see if there's a way to have a conversation with some young family members that you have, because it also helps them to be able to talk about the mortality of their older relatives, right? I mean, yeah, so thank you.
Okay, we have a question over here.
Yeah.
Actually, it's two parts. Can you have both? You can.
Absolutely, and we recommend that you do have both, especially if one of those conditions like a chronic or a life-limiting illness, absolutely.
Okay, and the second part is, since if you call 911 and they have to, by law, resuscitate you, if you have it in your advanced care directive that you don't want to be resuscitated, what happens when you get to the hospital and they put you on all the life support? I guess they look in your files and say, oh, she didn't want to be resuscitated, so they pull the plug? Or
That's where it gets more complicated. The advanced directive, just to make sure we're clear, doesn't actually, you can give some advice on what your wishes would be, but it's not an order. It's not enforceable. So even if you showed up in our emergency room and we saw an advanced directive that kind of gives us the idea that you probably wouldn't want a lot of heroic measures, without a POLST form, we wouldn't have an order. So I would strongly recommend, if you have a strong desire for yourself or whoever you're caregiving for, that they not be resuscitated, that you do the POLST form and have it in a very visible place. If you travel, carry it with you, have it so that there isn't a question. Yeah.
Michelle, we have a question over here.
Okay.
Can you make copies of it, or does it have to be an original?
Absolutely, copies count. And sometimes you'll see copies on white paper. Technically, originally they came out on cardstock. It's really hard to get pink cardstock, I've discovered. So I have it on pink paper. That's legal. Cardstock's legal. You could even have it copied on white paper and it would be legal. And copies definitely are legal.
My husband was in the hospital for quite some time this past year at Kaiser, and it seemed like we were always getting, I don't remember if we were getting, I think we got both, and I think we got them more than once, these forms, and I remember signing them and signing them again. Is that normal?
Well, I would think that if you feel like you've already filled one out, I would check your files and then ask them to check their files. You shouldn't need to continue executing one. So if you feel like you've already filled one out and you've given it to them, I would ask them to check their records more clearly to make sure, unless you want to change it, because then you can always do that. But
Okay, and another part to that question.
Yeah.
It seems like he went directly from the hospital to a skilled nursing facility, and it seemed like we did it again when we got there. Now, is that normal?
Yeah, was that the POLST or the advanced directive?
I don't remember.
You're not sure.
I mean,
yeah.
I was kind of sure.
That you were asked to do again when you got, yeah, I mean, what I would do is make sure you have a copy with you so that you can just say, we already did this, here's what it is. Yeah, I mean, I think each place, again, because it's federal law for the advanced directive, will need to ask you, but that doesn't mean that you need to fill out a new one every time. Yeah, no, you should only have to rethink it when you need to rethink it for different reasons. But yeah, not every time that you move from one place to the next. Yeah.
Okay, we have a question over here.
Do you have a recommendation? I know for my elderly parents, they're saying to put these visible on the refrigerator. For someone like me, who could be in a car accident or something like that, is there a protocol where the fire department or the police or something, if I'm in this car accident, will go into my wallet or my purse?
Yeah.
Like, where would you put this that they recommend? That would they actually fish for it?
Yeah, you could put a card in behind your, I have like my American Red Cross card right behind my license. You could put a card in and say, my decision maker is X, call them at this number. I have a POLST. And another tip that someone gave me at a conference I was at is to put a copy of your POLST in a brightly colored envelope in your glove box. Because they probably will look through to try to find identifying information. And then also make sure that if you are that your doctor has a copy, and if there's a hospital that you frequent, that they have that in their system. Because then the first thing I do as spiritual care coordinator, I show up in the emergency room when an ambulance comes in with a code 3, which means someone's seriously ill. I show up, first thing I do, they're taking care of them medically. I check in the record to see if we have any information on their advanced healthcare wishes. So that would be some of my advice.